As we speak, Republican senators working behind closed doors on their health care plan. But the political director of ABC will join us to try and shed some light on what's actually in the bill and where it will go from here. We're also going to be getting reaction from New York Senator Kirsten Gillibrand. Then, what's happening in Georgia isn't staying in Georgia. That special election, as we speak here, going on. In fact, the polls will close in less than an hour here, and it will be closely watched as a referendum on President Trump and the grand old party. Also, we put a human face on the cuts to food stamps in President Trump's budget. Dominic will speak with people who would be personally hurt the most by it, and they tell us just how bad it will impact their lives. Good evening, everybody, and welcome to RFL. I'm Richard French. Thank you so much for joining us this Tuesday evening. Senate Republicans, they're confident they have enough votes to pass the Obamacare repeal. Here's Majority Whip John Cornyn during a radio interview today.
It won't be perfect, but if it's better than Obamacare, I think we will have fulfilled our promise. We'll be able to get health care and tax done with 51 votes, and we just need to work harder.
In the meantime, Majority Leader Mitch McConnell, he's pushing for a vote by July 4th's recess. All that's missing, well, is an actual bill. Leadership is planning to brief members on their framework tomorrow. Then they could have an actual bill to read Thursday. That would be in 2 days. But so far, everything is being done behind closed doors. So Democrats, as well as ordinary Americans, they're left out in the dark. Minority Leader Chuck Schumer, he's concerned his caucus won't even have enough time to review the thing once there's an actual final bill. Here's the New York senior senator and Mitch McConnell squabbling about that very issue on the Senate floor.
Since this is a complicated bill, to review the bill, will it be available to us and the public more than 10 hours before we have to vote for it?
I think we'll have ample opportunity to read and amend the bill.
Will it be more than 10 hours? That's not.
I think we'll have ample opportunity to read and amend the bill.
I rest my case.
In Washington land, that counts as basically a diss. All right, for more on that and what could be in the bill, Andrew, he spoke earlier with ABC News political director Rick Klein. Andrew?
And Rich, here's how confusing everything is with health care right now. This morning, I was reading that the Senate, and there's some reports out of the Senate, that they were considering whether to go further than the House bill when it comes to removing protections for pre-existing conditions and other issues. Those issues now guaranteed under Obamacare. But this afternoon, when I spoke with Rick Klein, he told me the exact opposite. The Senate is now seeking greater protections. So what else is Klein hearing on health care from the upper chamber? We spoke this afternoon. So, Rick, everybody's waiting to hear the latest on health care and that mystery bill in the Senate. Are you hearing anything about what's in the bill, what's not, or how it might differ from the bill the House passed?
We're looking at some significant differences here, particularly around pre-existing conditions. We've had the president even come out and say he wants to do more. There's buzz that the Senate bill may entirely protect people with pre-existing conditions, that they may not go there at all in terms of trying to rejigger. You remember that was a big deal in the House bill to try to give states that option of getting out. But the fact is we don't have details. No Democrats have seen the bill, and even most Republicans have not seen the bill. They're trying to get it done this week, and it's all happening under the cover of a lot of darkness.
And, of course, that also opens up Pandora's box. If the Senate passes a version of this bill that's significantly different from the House version, would the House then turn around and reject it, or would they pass it again? Any reaction so far from House members?
Well, if you recall, the reason that the House rejected it last time is that a bunch of conservative Republicans felt like it didn't go far enough in terms of doing away with Obamacare, and that means doing away with a lot of those protections and giving more flexibility. They had to move it more toward the right, and if they have to move it back toward the center, it does upset that balance. And this bill ultimately will have to go past both the House and the Senate in its revised form all over again. There's a sense talking to senators, they just want to move this along. They just want to get this done so they can say that they have acted. And then hope for better results down the road. But I don't know, a lot of people are optimistic about the politics being much different.
Let's talk about the process in the Senate a little bit. Democrats complaining left and right that they're not being allowed in the process. They have no idea what's in the bill. Republicans say Democrats simply don't want to participate. How open is this bill, and how does this compare to how Obamacare got through 7 years ago in terms of openness or lack of transparency?
It's night and day, to be honest. The Obamacare bill was debated very much in public, hundreds of hours of hearings. The stakeholders knew what was happening. There were some parts of the deals that weren't transparent, and I think the final process at times was rushed, but people knew what was in that bill before it passed. In the case of this Senate bill, virtually nobody. As I say, most senators don't know. There was a real transparency argument. There were a lot of people who complained that there wasn't enough openness last time around on the Republican side, saying that right now that those words sting them back. Those tweets don't age too well if you look back at what they say. The fact is that they realize the politics of this are so questionable that the only way to do this is to negotiate it privately and then hope you can keep your coalitions together.
The other difference that we're seeing is from the president when it comes to how health care was handled. He was very involved in the House process, was twisting arms at the White House. We've barely seen him involved in the Senate process so far. Do you anticipate that he'll ramp up his presence, or do senators want to keep him at a distance?
They want him far from this because they realize that you're talking about just a couple of votes. There are 52 Republican senators. You have to keep them essentially all on board if you're going to pass this. You can only afford to lose 2 and then have the tie broken by Vice President Pence. So the fact is that when you're playing any of the political pieces of this, you're upsetting really delicate balances. Senators' message to the White House, stay away from now. You can keep tabs, you can have some input, but right now the best help you can be is to let senators work their magic, see if they can get the votes. The president will have to be more involved, particularly if it gets to a House-Senate conference committee and if it gets down to the last vote or 2. But as of now, their best bet is banking on the president to stay out.
We're also hearing that Mitch McConnell is cracking the whip on Republicans, with perhaps threats of committee chairmanships lost or other leverage that he can exert. How far is Mitch McConnell putting the pedal down on this one to try to get it passed?
Look, he wants it done. There's no question. There's a limit to what you can do, United States senators, and we haven't seen Mitch McConnell really rub up against that yet. He wants to get this done. Right now, it's more in the pleading stage than the threat stage, from what I can gather. They're telling Republicans, look, you campaigned on this. If we go back to voters and say we didn't get this done, it's almost embarrassing. So their feeling is that they have to stick together as a conference. Mitch McConnell doing his best to make that case one senator at a time.
And finally, Rick, we've got a special election in Georgia today. There was actually the home district of the Secretary of Health and Human Services. The results of that may have an impact on how the Senate handles this health care bill and whether they put oven mitts on for it or not. How closely are members of the Senate watching that race in Georgia today?
Yeah, the senators and House members are very much dialed into the politics of this. We talk about a lot these special elections. What does it mean for the midterms next year? Well, let's think about this year and think about the governing agenda. This is a real-time snapshot of voter sentiment in a potentially swing district, the kind of district that could turn a big election for Democrats into a landslide, or they could hold the firewall for Republicans. And so to have voters weigh in a district like this at a time like this, critical information that these political creatures, members of Congress, will take into account as they deliberate on health care and so much else this year.
ABC News Political Director Rick Klein. Rick, always appreciate the analysis.
Thank you.
And with that, on the other side of the break, New York Senator Kirsten Gillibrand will join us, and she'll weigh in on the healthcare debate and how she feels about all the secrecy attached. Then our panel will debate and discuss where the plan goes from here.